The best practice is the lowest effective dose, your third psychiatric consultation. Today we're going to discuss the issue of the LD50, the toxicity at which 50% of the people that take a given dose of a substance die, and 50% of the people that take that same dose live. The physiologic reserves are quickly overwhelmed with massive doses of water and other substances. The LD50 is the dose at which half the population dies when taken rapidly. Just about everything has an LD50. The LD50 for water is 6 liters. Half the people who drink 6 liters of water rapidly die from water intoxication. The LD50 for medications is not known, precisely as it is not ethical to experiment on humans to find out what the LD50 of medications are. Aspirin is a good example. The exact LD50 for aspirin is not known. However, review of a large number of overdoses results in a consensus that 150 milligrams per kilogram or 6.5 grams of aspirin is a lethal dose for a 100-kilogram man, a man weighing 220 pounds. A lethal dose is between 6.5 and 15 grams of aspirin. 15 grams of aspirin are equal to 46 325 milligram aspirin tablets, or 81 milligram tablets of aspirin. You can buy 1,325 milligram tablets for $10 online. The LD50 for amitriptyline is not known. The maximum daily dose of amitriptyline is 300 milligrams a night for the treatment of depression. I read an anecdotal report of a patient dying after taking 1,500 milligrams, a 5-day supply of amitriptyline. Historically, amitriptyline is the most common cause of death by overdose among the antidepressants, accounting for about a third of those deaths. This is because tricyclic antidepressants tend to be the most toxic as compared to other psychotropic medications. Symptoms of amitriptyline overdose prior to death include hypothermia, respiratory depression and arrest, coma, seizures, abnormal tendon reflexes, confusion, agitation, myoclonic jerks, excessively brisk reflexes, and extensor plantar reflexes, cardiac arrhythmias, bundle branch block, cardiac arrest, low blood pressure, circulatory collapse, dilated pupils, blurred vision, tachycardia, vasodilation, urinary retention, decreased gastrointestinal motility, decreased bronchial secretions, dry mucous membranes, hot, dry skin, tachycardia. Many of these side effects are atropine side effects shared with many other medications on the Beers list of medications. The Beers list is a list of medications that should be avoided among the elderly. In the real world, overdose is usually in combination with benzodiazepines, alcohol, and other substances that increase the risk of respiratory arrest and death. Karen Ann Quinlan, who was born on March 29, 1954, and died on June 11, 1985, is a famous example of drug overdose by multiple agents. Opiates often result in death from respiratory arrest when combined with benzodiazepines and sleeping pills and alcohol. Any medication side effect is toxicity that could lead to injury or death in the near term or the far term, depending upon the patient's DNA and other intervening variables, including diet, other medications, stress from heat, cold, and other issues. Look up the symptoms of overdose to understand the toxicity of your medication. After Elavil, toxicity of other psychotropic medications, starting with the most toxic to the least toxic, follows. Monoamine oxidase inhibitors with cheese, tricyclic antidepressants, lithium with narrow therapeutic window, excessive heat or excessive exercise can result in toxicity and death with lithium. Venlafaxine, valproic acid, bupropion, quetiapine, olanzapine, ziprasidone, carbamazepine, desvenlafaxine. This is just a short list. There are literally hundreds of psychotropic medications used according to the FDA, and an additional list of medications used off-label. Many psychotropic medications are omitted from the above list because toxicity in terms of LD50 and death is really not known very well. The reason that the LD50 is not known is because most overdoses are with a mixture of medications, alcohol, and street drugs. Listing the relative toxicity has very limited value as a result. Chronic exposure to psychotropic medications can result in death from liver failure, kidney failure, pancreatitis, loss of white cells, loss of red cells, weight gain, diabetes, hypertension, stroke, low sodium. The other long-term side effects include polycystic ovaries from Depakote and tardive dyskinesia from antipsychotic and other medications. Tardive dyskinesia is not a trivial matter. It is an abnormal motor movement at rest. It is cosmetically disfiguring, and patients have committed suicide on that basis. The end stage of tardive dyskinesia results in difficulty in breathing and swallowing. When severe, the patient has to have a gastrotomy for tube feeding directly into the stomach and a tracheotomy for breathing to bypass the mouth, nose, and throat, compromised by a movement disorder. It would require hours of education with questions to ascertain adequate understanding of the hundreds of side effects of each medication. I generally advise the patient to read the package insert, and if the patient does not understand something or is concerned, the patient can defer taking the medication until after making additional appointments to review the package insert before starting the medication. The patient and family should understand the trajectory of physiologic reserves from birth to death. Tomorrow, I will address that issue. Thank you for your time and your kindness. Have a great day.